Hi, I'm Ampreet, a fourth-year medical student at the University of Birmingham and a presenter here at the Aspiring Medics. Today we're going to go through 10 key motivation questions for medicine.
Station 1. If you receive 4 rejections to medicine this year, what will be your next steps?
I understand, first of all, that receiving 4 out of 4 rejections this year is a possibility. Medicine has always been a very competitive field, and over the past few years it's become a lot more competitive as well. However, I think I'm very much prepared to face this problem if it were to arise for me, because at the end of the day, medicine has been a lifelong dream of mine, and it's a long-term commitment that means that I'm prepared to apply again the year after. And what I do, I think there are several steps that I would take. So the first one being making sure I'm very resilient in the situation, taking care of myself, reflecting on feedback, reflecting on where I've gone wrong, and making sure I receive a lot of feedback from my mentors, my supervisors. After having spoken to a lot of doctors, having witnessed a lot of consultations, having spoken to them about their careers, I know for a fact that medicine can span decades almost. It takes a very long time for people to specialise in, and throughout that journey, failure is inevitable. So having a growth mindset and being resilient is something very vital and very distinctive of what makes a good doctor. And therefore I think that if this situation were to arise, it would only help me become a better applicant for the year after and a better future doctor as well. Second of all, I also know that if this situation were to arise, I'd be very upset. I'd honestly be heartbroken after having spent so much time, so much effort over the past few years for my application and my interviews and whatnot. So I definitely prioritise taking care of my mental health by speaking to my friends, my family, and making sure I really stay on top of my well-being as well. The most important thing that I can do if this were to happen is reflect on where I went wrong during my application. Whether it was, for example, my UCAS score didn't fall within the range for my application, so I'd work on improving that score. Or if it was my personal statement, had I not received the relevant work experience, or had I not reflected on my work experience properly, I'd also work on that as well. Additionally, if the problem were to be in my interviews, I'd also seek help from admissions experts and tutors, so I can really knuckle down and understand the right way to structure answers for interviews as well. So overall, there are several steps that I would take. Medicine is a lifelong passion for me, and my commitment to it is unwavering, and I will continue to build upon my skills so I can reapply again the next year.
Station 2. Describe an encounter during your work experience where the healthcare professional did not display empathy towards a patient. What could have been done differently to ensure a compassionate and patient-centered approach to care?
During my work experience at my local hospital in the A&E department, where I was shadowing a consultant, I noticed a lot of great interactions between him and other doctors with the patients. However, there were the rare cases where this wasn't the case, where I really believed that the consultations lacked a lot in compassion and empathy as well. So in this particular scenario, it was a very busy Monday morning in the A&E department, and we were to see a elderly gentleman with my consultant, and the doctor moved straight to the patient without really acknowledging them and fired away instantly with very medical based questions surrounding what the patient came in with. And I noticed prior to the doctor having started the consultation that the patient looked very stressed or very worried. However, this wasn't really something that the doctor acknowledged, and soon after the consultation was over, he moved on to the next patient. And this definitely had a lot of negative impacts on the patient, and I will discuss these as well as talk a bit more about the importance of remaining professional and having respect in consultations as well. After the consultation was over, I remained with the patient and spoke to them a bit more, and from what I could see, they came into A&E feeling very distressed and anxious about their symptoms, which they were experiencing. And after the consultation, they felt, if not a lot more stressed and worried about what they had, since all their worries hadn't really been alleviated. And they also didn't really feel heard by the doctor either. and this left them feeling very isolated and very vulnerable. Empathy is very crucial when it comes to communication with the patient, because it builds trust, it builds a connection with them, and it allows for a more open conversation as well with the patient. Regardless of how busy the A&E department was, it's very important that clinicians remain professional and have respect for the patient by treating them the same way they would any other patient, which is with patience and with a lot of compassion as well. A simple acknowledgement of the patient's fears, whether that be a few empathetic words, a slight touch on their arm, can really change how the consultation goes, and it really affects how the patient feels after they've been consulted by the doctor. It's really important that healthcare professionals balance the work, the stress, along with prioritizing the patient's need and making sure that they feel heard and understood. And going forth from what I've seen in this consultation, I'll definitely bear in mind how important it is to remain empathetic, regardless of how busy things are or how many patients that I may have seen in my career, to always keep the patient at the forefront of my mind and make sure I'm addressing all of their needs.
Station 3. Medicine is constantly evolving with new research and technologies. Describe how you plan to stay adaptable and embrace change to remain at the forefront of medical advancements throughout your career.
Medicine is an ever-evolving field, particularly after the COVID-19 pandemic, where we saw an increase in telemedicine and personalised medicine being used a lot more. And there are definitely a lot of ways in which I can make sure that I stay on top of these advancements as I progress throughout my degree as well as in my career as well. The ones that I'll be discussing are to do with staying committed to lifelong learning, being open to more training, seeking mentorship when it's available, and practicing medicine that's evidence-based as well. So what we mean by staying committed to lifelong learning, there are a lot of ways in which someone can go about this. So how I do it is I'd make sure to attend as many conferences regarding emerging technologies and treatments, reading all the relevant journals, and on the whole being active in discussions involving upcoming technologies and upcoming advancements as well. Additionally, I'd also stay very open to specialised training throughout my career as well, so I know how to tackle advancements when it comes to particular treatments and particular procedures, so I can give the best care possible for my patients as well. Additionally, it's also very important to seek mentorship from colleagues who've already navigated these waters, or mentors who are experienced in these upcoming technologies or these latest advancements as well. And finally, I'd also try and practice medicine that's evidence-based, since I believe it's key to delivering high quality care. And how I do this is I'd continuously review any guidelines, any studies regarding particular treatments, particular technologies, so that the clinical decisions that I'm making regarding my patients are backed up by the latest evidence, essentially. To be able to do all of the things that I've just mentioned, it's very important to stay adaptable as you progress throughout your career and take on as many opportunities regarding research and specialisation as well, which is something that I saw during my work experience, where I was sat in clinic with a lot of the consultants, where I discovered that alongside a lot of their clinical work that they were doing, they were heavily involved in research regarding novel medicine, novel treatments, telemedicine, and I found that to be quite admirable, but I also found that to be extremely important. So overall, whether it's incorporating new AI diagnostic tools in my practice, all the way to telemedicine, for example, I'm very open and keen to learn about these as I progress throughout my career.
Station 4. Would you still want to be a doctor if the highest salary you could earn was £25,000 a year?
So to answer this question, I will focus on my intrinsic motivation for medicine, as well as what I find personally fulfilling in terms of a career. I believe that my desire to study medicine definitely stems from my innate need to improve the quality of the life of a patient, help them at their most vulnerable, and be able to alleviate all their suffering when they're in the darkest time of their life. Improving the quality of life of a patient is the core reason why I want to study medicine, as opposed to the financial gains. Additionally, I find purpose in solving complex problems that come with this career, where we're faced with a lot of challenging patients, a lot of challenging cases, as well as being at the forefront of innovative transformations to improve healthcare even more. On the whole, I do believe the true reward with medicine lies in the positive impact you have on a patient's life as well as on society as a whole. However, that being said, I believe continuing as a doctor all the way from being a junior doctor to a consultant with that salary may not be feasible. There are a lot of costs that you have to consider when you are a doctor or when you're progressing throughout your career, such as travel when you're a medical student, when you're a junior doctor, renewing medical licenses, having to pay for conferences and the respective journals so you can progress in your particular specialty. Furthermore, there are also the personal aspects to consider when you are a doctor as well. For example, if a particular person wants to start a family, that salary may not be enough to support all the costs that come with that. Furthermore, with the cost of living crisis being very high right now, this can add to the financial burden that these doctors face. With this financial burden and the financial stresses that can come with a salary of 25k, it can impact the emotional state of the doctors as well. It can lead to them being more stressed. At work, for example, these doctors may be working more hours to make ends meet, which can in turn lead to them being very tired, very fatigued, and therefore lead to a potential increase in medical errors when they are on the wards, which can have very negative consequences on the patient. Overall, although my desire to study medicine does come from my need to help patients improve their lives, I do think it would be very difficult to do so with a salary like that, where I won't be able to have enough financial means to specialise in a particular field that I want to go into.
Station 5. Studying medicine requires discipline and academic focus. What strategies have you acquired at A-level to help you remain dedicated to this degree?
There are several different things that I've learned through my studies at A-level that I think will definitely translate into studying at medical school. And I'm going to discuss things such as effective time management, self-care techniques, staying resilient, managing time effectively, and also seeking the right support when it's needed. I definitely believe my A-levels have been a lot different to my GCSEs, where workload was a lot higher. There were more formative and summative assessments throughout the 2 years, and overall there was a lot more content. And understandably, I had a lot of setbacks during my A-levels. So I definitely learned to have a growth mindset and keep on pushing through, which I definitely think developed my resilience on the whole. Additionally, I also learned the importance of staying on top of my self-care, making sure I allocate time for my hobbies, as well as this, I made sure to eat healthily, exercise on the daily, see my friends, and really have a good work-life balance, which I think is very important in medical school, especially with content being a lot heavier than A-levels, but also the medical field in general, where working hours tend to be a lot higher compared to other jobs. I definitely adapted the way that I learnt and the way I utilised feedback during my A-level, such as focusing on topics that I did less well at and really honing on those right before exams as well. In terms of effective study techniques, I definitely learnt that spaced repetition worked a lot better for me as an individual, and I look forward to using this in medical school as well. I think the most important thing that I've definitely learned from my A-levels is being able to effectively manage my time, and this came from juggling my A-levels as well as my extracurricular activities into, for example, a calendar, which definitely helped. I also found that setting realistic goals helped me stay on top of being able to achieve them and carry on progressing throughout my A-levels as well in a healthy way, essentially. Overall, across my A-level studies, I did learn a lot of things, like I said, effective time management, different studying techniques, staying resilient, but I think the most important, or if not the overarching theme, was self-discipline. So staying organised, staying committed to my learning, and staying committed to my passion for studying medicine definitely helped.
Station 6. What would be your biggest fears in practicing medicine?
I think medicine is definitely a very rewarding career, but it does have some challenges that do come with it. And I believe that my main fears would be to do with the uncertainty that comes with medicine, the responsibility that comes with making life-altering decisions for patients, as well as being the fears that come with balancing that work-life balance as a clinician as well. In terms of being able to manage uncertainty, I think what I'm particularly worried about is, for example, a patient coming in and not knowing what they have after thorough assessments, thorough scans, still being left with no clue as to what they have. However, I do think there are ways to tackle this by remaining very calm, remaining methodological, going through all the respective protocols and the guidelines, but also talking to my colleagues and my peers about this. From what I've seen in my work experience, when consultants are stuck in clinics, they go over to their colleagues and they do have big MDT meetings where they discuss what the next steps are for the patient. I understand that uncertainty is part of medicine. However, I hope to further develop my problem-solving skills to make sure I can address these challenges with a lot of confidence in the future. Another thing that I find to be somewhat concerning is the responsibility that a clinician has when making these decisions regarding a patient's care. And although it's a great honour to be doing this, if the decisions that a clinician does end up making end up being wrong, then it can have significant consequences for a patient's health. For example, I've seen patients on the ward being given drugs like penicillin and them having severe anaphylactic reactions to them. This can have, again, very bad consequences on the patient's overall well-being. To cope with this, I think it's very important to stay well informed, to escalate when matters get out of hand, making sure I consult my mentors, my peers, and always prioritize patient safety above all else to make sure that I'm making the right decisions for them. Finally, balancing work-life is something that has been on my mind, particularly with what I've been seeing on the news lately about the working hours of doctors, of junior doctors, since medicine is a very demanding career with long hours and with a lot of dedication. However, I do think there are ways to cope with this and to tackle this as well, and these would include setting strong boundaries with when I want to work, how long I want to work for, as well as also prioritizing self-care, where I'm speaking to my friends, my family, doing all of my hobbies, and I think all of these can help with maintaining that work-life balance in the long run. By acknowledging these fears, such as avoiding burnout throughout my career, throughout my degree, I hope that I'm better prepared as a clinician in order to tackle these problems face to face and mitigate any future problems they may cause throughout the rest of my career.
Station 7. Advanced Nurse Practitioners have authority in patient diagnosis and can independently assess, diagnose and manage patients with complex clinical issues. Why have you chosen to study medicine as opposed to pursuing a career as an ANP?
Although I do appreciate the very important role advanced nurse practitioners have in a patient's care journey, I do believe that my choice in studying medicine aligns more elegantly with my aspirations in terms of my long-term career plans. And so to answer this question, I will definitely be talking about what my aspirations are, the depth of knowledge I gain as a doctor, and the difference in clinical challenges I'd see as a doctor as opposed to being an advanced nurse practitioner. So in terms of my long-term career vision, I want to be more involved in making changes in healthcare policy and being more directly involved in making changes in clinical practice. Medicine definitely offers a broader career path where you can get more into teaching, leadership, as well as research too. The comprehensive training received at medical school, such as a skill surrounding how to appraise literature for research, can definitely help on taking these roles, ultimately allowing me to have a broader impact on patient care and societal impact in the longer run. Additionally, the breadth and the depth of knowledge that you receive whilst going through your medical training is very extensive, and I think it definitely feeds into my desire of wanting to learn more about the scientific processes and the the biologic processes behind particular disease progressions, for example. Additionally, studying medicine allows me to delve into a variety of specialties ranging all the way from cardiology to dermatology, and all of these specialties are very much interlinked and can contribute to advancements and knowledge in each other as well. And I believe this more comprehensive training and learning can provide a more holistic approach to patient care that's again more comprehensive and can lead to better patient outcomes. And finally, the kind of cases that you do encounter as a doctor are more complex, and it definitely feeds into my desire of wanting to solve them in a more innovative way and my need to do a lot of problem solving as well throughout my career. Engaging in these problems more head-on allows me to be involved in the management of these patients more directly, and I can tackle their problems in more of an intricate way, whilst also collaborating with different healthcare professionals too. In summary, my choice to pursue medicine as a doctor as opposed to an advanced nurse practitioner is rooted in what I want to do in my career in the long run, such as being involved in research or in teaching, as well as the depth of knowledge I gain while studying all the specialties in more detail, as well as my desire to tackle complex cases more head-on as well.
Question 8. What do you consider is the greatest challenge for doctors, and why does this not deter you from medicine?
I think medicine on the whole is a very challenging career, and it does come with a lot of challenges that doctors do have to face within it that range all the way from having to work very, very long hours, the very high stress, emotional situations that you get put in, which then have a negative impact on your emotional state as well as having to balance patient expectations and the responsibility of making these very important decisions for patients as well. However, I do believe that emotional stress is probably the biggest challenge that doctors do face. And I say that because after having sat in a lot of consultations with doctors during my work experience and having spoken to a lot of medical students, they've had to break a lot of bad news to patients surrounding cancer diagnoses, for example. And sometimes these cases involve just bad luck, where young patients are being diagnosed with very rare conditions. And these kind of scenarios and situations, they do stay in your mind, they do stick with you. And it can be very emotionally taxing. It can have quite a negative impact on your own well-being as well. However, I do believe this aspect of medicine creates an opportunity for growth and to develop resilience. However, I also believe that it really hones in the idea of having a patient of having patient-centered care, where you acknowledge that the situation is also distressing for you, but you can put that at the back of your mind and continue giving the patient the best care possible without letting your own emotions get in the way. Although this can be quite challenging, I do believe there are a lot of coping strategies that you can use in order to help you get through these times, such as developing mindfulness, speaking to colleagues, family members when emotional stress does get a bit too much. I'm very committed to developing these strategies, and I hope to embrace any challenge that does come my way as I navigate this career with a lot of confidence and with the right support system as well.
Station 9. Health disparities persist in many communities in the UK and worldwide. Discuss how your motivation to study medicine extends beyond individual patient care.
Although individual patient care is very important, there are a lot of things that can be done which I'm motivated to do so, such as promoting preventative medicine and addressing healthcare inequalities to tackle health disparities that affect the wider population as a whole. And in order to tackle these problems, a lot of collaboration needs to be in place between policymakers, stakeholders, a lot of healthcare professionals, so we can implement these changes. There are a lot of social determinants of health, such as socioeconomic status, living condition, education, that can all have a positive or negative impact on a patient's overall well-being and essentially create these healthcare disparities. There are a lot of social determinants of health, such as socioeconomic status, education level, and living conditions that can all have an impact on a patient's well-being and create healthcare disparities. And I'm very keen on promoting public health initiatives that can tackle these problems and alleviate these disparities that we do see in areas of, for example, lower socioeconomic background. So I'm very keen on promoting things such as healthcare campaigns to promote better health, or to raise awareness of conditions such as HIV, for example, where there's still a lot of stigma surrounding it. And once these campaigns do get put in place, we can see this very marginalised population have better access to healthcare, or in fact be more aware that this help is out there for them. Additionally, there are a lot of conditions such as diabetes, hypertension, that do have very important lifestyle factors that do play into them, all of which can be prevented. And these kind of conditions are more so seen in areas of lower economic status, or areas where there's lack of education surrounding these conditions, or there's poorer access to the healthcare and the resources needed for the particular patient. Therefore, I think preventative medicine techniques such as vaccinations to tackle, say, the COVID-19 virus, and promoting these kind of campaigns in these areas can be very beneficial, not only just for the patient but for the wider population as a whole, because it promotes things such as herd immunity as well. So overall, I'm very motivated to provide a more holistic care towards a particular patient that not only just tackles factors that are individual to them, but it also tackles societal issues and issues surrounding the social determinants of healthcare as well.
10. The field of medical humanities explores the human experience of illness through art, literature, and narratives. Share an impactful patient story or work of art that has shaped your perception of medicine's humanistic aspects and influenced your commitment to patient-centered care.
I think when we look at medicine, we think of it as a very scientific field, and although on the whole it is definitely very scientific, it focuses a lot on diagnoses, management, treatments of patients, the humanistic elements are overlooked. And these human elements that we need to consider are things such as compassion, empathy, emotions like anger and sadness, which are seen a lot on the wards in hospitals and by doctors as they progress throughout their whole careers. And a particular story that I want to share when I was sat in a clinic with my consultant during my work experience placement was when we saw a patient who had HIV as a background disease, but also had cancer that had metastasized. Although the patient had been doing very well on the antivirals, they were too immunocompromised for any biopsies to be done or any treatment to be implemented. And with the most recent CT diagnosis that they had, the cancer had actually spread, and the patient only really had a couple months to live, essentially. And there couldn't be anything done to treat the cancer. And it really highlighted a situation to me where the medical aspects had essentially failed in essence. There wasn't a treatment that we could offer the patient, and we couldn't do any more biopsies essentially. So what I saw the consultant do is that he spoke very compassionately to the patient. He gave the patient time after he broke the bad news that the cancer had progressed. And these really highlighted the more human elements of the conversation that he was having with the patient. And these elements worked very well, and you could see the patient really gather his thoughts about the situation and speak to the doctor and the nurse in the room very openly about it. The doctor was also able to elicit, again, more human elements of the patient's background, for example, such as whether their family knew about the diagnoses, whether he'd want to tell the family about his diagnosis, whether he had the right support system at home, what was he doing at home at the minute. if there's anything he could do to distract himself or things like this. And again, it really highlighted that medicine isn't just about the treatments and the drugs that you give patients. It's about considering all aspects of the patient's life that you might not consider. For example, how they're doing emotionally, how's their family doing, will their diagnosis affect their financial status, will it impact how they live their life. This particular scenario really highlighted to me how important it was to be compassionate and have these very human elements of yourself be in play during a consultation, and not let the more technical things overpower the consultation. And overall, from what I've learned, is I'll definitely continue this throughout my career. For example, I'll definitely be more aware that these are things I need to consider and always elicit, and I'm very committed to having this very patient-centered care, incorporating all these different elements that can affect a patient's life.